Hello, HLHS parents, and welcome to first in a series that I'm going to do. I am involved with a lot of organizations that do research, investigations into HLHS or CHDs, congenital heart defects in general. Groups like NPCQIC, Heart University, the Cardiac Networks United, the Fontan Network, or Fontan Outcomes Network, HeartWorks. There's a number of groups out there, and they all have collaboration webinars and conferences and Zoom calls and what have you. And since I'm involved in them, but I know a lot of parents are not, I figured I would start reporting out on what they talk about, and sometimes the Heart University stuff is pretty high level medical. I don't understand a whole lot of it. I have to research terms, but I figured I'd start reporting out on that. Today's episode is going to be about webinar number 7 from the Heart University. It's concerned with the AEPC position paper on COVID-19 and children with congenital heart defects, or CHDs. So I figure that's pretty timely. AEPC stands for the Association of European Pediatric Cardiac Congenital Doctors. And it was a webinar put together. There were 7 pediatric cardiologists on the call. Two of them from the U.S., Italy, France, Sweden, Austria, and one other. I can't remember what country they were from, but they were reporting out on a number of things, position papers on the COVID-19. So it's webinar number 7. It was about 20 minutes long, followed by about 60 minutes of discussion between the various cardiologists and the treatment options they're pursuing, both for COVID-19 in children and for children who have the follow-up disease MISC, which is Multisystem Inflammatory Syndrome. So multisystem is the M, inflammatory is the I, and syndrome is the S, and -C is the variant. It also used to be called Kawasaki syndrome, and it presents in children who have had COVID, maybe asymptomatic COVID, and then afterwards they'll develop this multisystem inflammatory syndrome. Usually presents with flushed face, flushed lips, cracked lips, and a fever 102 or more. The more severe symptoms of MISC are shock, coma, and then placing the kids on some kind of ECMO. If you're not familiar with ECMO yet as an HLHS parent, you likely will at some point. Hopefully not for your own child, but at least from the time you're going to spend in the cardiac ICU. So pretty serious stuff. There have been some deaths, both in the childhood population, both from acute cases of COVID, which is very, very rare, but does happen. The vast majority of children present with almost no symptoms of COVID or very mild symptoms. Some children will get very acute cases of COVID and have passed away. I don't know of any fatalities due to MISC, but there have been plenty of kids who have gone into full shock and coma and have to be placed on ventilation or ECMO. So that was the discussion between the pediatric cardiologists. The 3 really big takeaways from the position paper and the discussion between the doctors about COVID and MISC is number 1, continue to practice social distancing, masking, continue to be vigilant. If your parents get vaccinated, basically be cautious. And the honest truth is the vast majority of us already know what that's like, because we know if we go home during the interstage period or between really the first year of life for our kiddos, their immune systems are fragile, and so masking or maintaining social distancing or just not having a social life in general is something we're all relatively used to. This sort of leads into the next two items, and that is that since we're so good at that stuff, we've kept our kids relatively safe from both COVID and MISC, that there's just not a lot of data concerning children with congenital heart defects, especially the serious ones like single ventricle children, HLHS kiddos. And so what they're not seeing is they're not seeing a correlation between congenital heart defects and severe cases of COVID in children or severe cases of MIS-C in children. So it's the good news on that front. They having congenital heart defect as a child does not appear to be linked with having a more acute response to COVID or to MIS-C as a child. Not true as an adult. Those seem to be correlated. Heart disease does seem to be correlated with a more acute case of COVID-19, and adults don't get MIS-C. They could have other problems down the line depending on their other medical conditions. So we don't know if that good news is because heart conditions in children are just not linked to acute cases of COVID-19 or MIS-C, or if it's because we as heart parents are just really good at keeping the kids from getting the disease in the first place, and so there's just not a lot of data. But as far as we can tell, whatever we're doing seems to be working. So we're moving into a phase where a lot of people are going to stop masking, where a lot of people are going to start ignoring social distancing or lessen social distancing, and that's fine for the general population. The takeaway from the experts, which the pediatric cardiologists, is to still continue to be precautious. And since most of our kiddos are not going to be vaccinated, and many of their siblings probably aren't anytime soon, at least children under the age of 12, that we should just treat it like it's still a pandemic. So, those are the three takeaways that we should continue to do our general social distancing, masking, continue to be cautious. That CHD does not seem to be linked with big cases or to severe acute cases of COVID-19 in children, and CHD does not appear to be linked to severe or acute cases of MIS-C in children either. A couple other points I want to go through, just because there was some good discussion, good talking, and these might be questions you have too. The first is there's no word on vaccine for children under the age of 12, that those trials are ongoing with various groups. So at the time of this webinar, it was even 16 years. So I know we moved to 12 with the Pfizer vaccine. So along that, timing of your vaccine with surgeries, if you have an older HLHSer or a child who has other heart conditions, the idea is to make sure, especially with transplants, to make sure you time the vaccine correctly. So, for instance, with transplant, you're going to go on to immunosuppressants after the transplant in order to avoid a reject of the transplant. Well, if you're on immunosuppressants and you take the COVID vaccine, it might not work because your immune system is, being suppressed. So you would, if you're going to get the vaccine, you would get that, 6 weeks prior to getting the transplant, because you would want to make sure you went through your full vaccine course. So it would be the first shot, and then 3 to 4 weeks later the second shot, and then 2 weeks after that. So you want to make sure any of that is timed and talked about with your cardiologist and your surgical team. So that's going to be true of any sort of surgery. In general, the expert opinion, and there's not a whole lot of data on this yet because the vaccine hasn't been approved for child use for really any amount of time, so there's no data, but the expert opinion of pretty much all the cardiac pediologists was that it would be good for CHD children or teenagers to get the vaccine. HLHS is included. Just make sure that if you're doing any surgeries that you time it correctly so that you're not complicating either the surgery or the vaccine working in the long run. So that was on that. As I said before, ECMO for CHD, very few cases. What they've seen, ECMO in general for use for children who have MISC. There was one case in Italy, one case in France, one case in Sweden. 2% of children who present with severe MISC or have to go to the hospital in the U.S., and one case in Australia. Nobody reported any fatalities. So that's good news, although, anytime your kid's going to go on ECMO, it's terrifying, so I understand. But it looks like relatively good news. None of those cases were CHD cases. They were just children from the general population. That doesn't mean, throw caution to the wind, of course, because it looks like CHD kiddos are effectively trending along with the general population. So whatever's good for them is good for our kids. And it's possible, because we're so good at taking precautions, that it would actually be worse, but we just don't know because we're so good at keeping our kids from getting sick. So another thing to consider about MISC, it's the cardiologist all said it was actually pretty hard to judge how sick the kids were. They had kids who presented with the basic symptoms of MISC, like fever, flushing, and red and cracked lips, and some of the other symptoms, who went into who went into shock within 24 hours and were in a coma. So the real lesson here, and the lesson we saw coming out of the early stages of the virus, is that if your child presents with MISC, and you go to the hospital. And a lot of people were avoiding going to emergency rooms, going to hospitals, because they were afraid of COVID. The reality is that children's hospitals were kind of ghost towns because of that. So, and all need to do right now surgeries have been postponed until kind of the current time frame anyway. So if your child, that's the general, whenever your kid gets a fever over 102 for a sustained period, you go to the emergency room. So just follow the general advice. Typical treatment for MISC seems to be, as far as I could gather, anti-inflammatories, which makes sense. And it seems like most of the treatments work. The big issue to worry about is hemodynamics. So with COVID and with MISC, like I said, CHD, congenital heart defects, don't seem to track or correlate with severe cases of COVID-19 or MISC in children. However, poor hemodynamics do, and what that points to is having pulmonary issues. So if your kid is more than just HLHS, he has other problems, then that may be something you need to consider, before easing up on precautionary measures, is because hemodynamics issues do seem to correlate very strongly with having severe COVID-19 or severe MISC cases, and so that's something to be concerned about. Pregnancy. So as far as anybody can tell, and there's just very little data on this, there's almost no transmission between mothers and children. So if a mother gets COVID-19, it does not appear that it transfers to the child. However, there's just a ridiculously low amount of data on this. I want to say there was one study in Italy that showed there was a 3% transmission rate between mother and child, which is very low. But we're not talking just a large number of cases here. So if you're pregnant, continue to be cautious, continue to take the normal precautions, masking, social distancing, and not having a social life, which if you're pregnant with an HLHS, you probably have started to realize you're not going to have much of a social life till you get out of the interstage period, just because you want to keep your kids safe and get to the other side of it. So those were the big takeaways. One last thing, they talked about general treatment for COVID or severe COVID out of the position paper in children. There does not appear to be a good set of medications for treatment, and I think this is true among both children and adults. But they have discovered there's lots of bad medications, and so there is a list of medications they have that they would, if your child got COVID, that they would probably either not prescribe or they would take off if they were using those medications for some other portion of their heart. Progesterone did not show up on that list, and if you're not familiar with that, it's the drug they give HLHS kids after they're born until their first surgery in order to keep their ductus arteriosus open, or in other words, to keep the blood flowing to the whole body. And so it's not just a closed circuit between the lung and the heart. That's what keeps our kids alive until their first surgery, until they're born with. So I didn't see progesterone on the list, which is good, because it's pretty much it's our only drug in that arena that I'm aware of. So that's the main takeaways. It seemed like mostly good news, as far as I could tell. So I walked away fairly heartened by that. It does not seem that that's one or two things is going on. Either CHD and HLHS is not linked or correlated with severe cases of COVID in children, or severe cases of MISC in children, or we're just so good as a parental community at keeping our kids safe that there's no data. So, it looks like we're going to be relatively clearing and entering a state of herd immunity soon, in the next 6 to 8 months with COVID. So things are looking well. Whether or not vaccines are going to be recommended for our kids is not something we know yet. There was no discussion of that by the cardiologist, because at that time, I think 16-year-olds were the newest age group. They hadn't even lowered it to 12 yet. So I'm sure there'll be another webinar or group on that. Hurt University has done 2 Facebook talks about COVID and CHD in the past. This webinar was a little more formal, but they've been very good about it. So it was either Hart University or it was the Children's Heart. I think it was the Children's Heart Network. Either way, there is advice out there, and of course, always talk to your doctor. But the main thing is continue to stay vigilant, protect our kiddos. Work with your cardiologist on back to school sort of stuff. But it looks like right now things are in a good way for kiddos with CHDs, as long as we contain vigilant with social distancing and masking and whatnot. So main takeaways. Thanks everybody for checking out the video, and remember, reach out, use the various groups, talk. We're all in this together, as I always say. We are all in this together. Thanks.